If you have problems walking through the grocery store, we have solutions. Spinal stenosis could be the culprit, and spinal stenosis can be improved by providers that know what to do. Hey folks, I'm Dr. Jeff Williams with Creekstone Integrated Medical in Amarillo, Texas, and I've got some important information I'm pretty sure your loved ones would value. So I encourage you to share when you're finished. Many of our patients, they say that they have problems walking through the grocery store without stopping to sit down for a moment, sometimes several times through the process of going through the grocery store. They also tell us that they get through the grocery store just fine as long as they have a shopping cart to lean forward over and rest their elbows on. It's called the shopping cart sign, and while it may not be 100% foolproof giveaway type of an orthopedic test, it sure is suggestive of lumbar spinal stenosis. So what is stenosis exactly? Well, Johns Hopkins tells us that stenosis can happen anywhere along the spine, but is most common in the low back. And I describe it to my patients in the way that you have a hole, and for one reason or another, that hole has become smaller. The problem with that is that really important stuff runs through those holes. Mostly nerves are running through those holes. And when the holes are smaller, well, that means the nerves can be a bit compromised and have a harder time getting their messages where they're supposed to go with the level of signal that it should be getting there with. Now, Johns Hopkins continues by saying, spinal stenosis is common because osteoarthritis begins to cause changes in most people's spines around the age of 50. That's why most people who develop symptoms of spinal stenosis are 50 or older. Women have a higher risk of developing spinal stenosis than men. And besides osteoarthritis, other conditions or circumstances can cause spinal stenosis as well. Having a narrow spinal canal, injury to the spine, spinal tumor, certain bone diseases, past surgery of the spine, rheumatoid arthritis. Those are some of the things. Now, lumbar stenosis is the problem in roughly 3 to 5% of back pain patients, according to my research. And while Johns Hopkins didn't list it, sometimes you're simply born with a smaller bone structure at key points of the vertebra that make a person more susceptible to stenosis than others. So every now and then, back pain actually can be hereditary. Not all the time. In fact, usually it's not, but it can be. Now, how do I know if it's stenosis causing the pain? Well, stenosis is typically aggravated by extending at the waist, leaning back and rotating at the waist. This tends to make your back talk back if you're dealing with lumbar stenosis. See what I did there? Again, one of the signs is the grocery cart sign. That's when a person can't make it through the grocery store due to their back pain, but if they have that shopping cart that they can lean forward with their elbows resting on the cart, kind of bent forward at the waist, then they can usually do pretty good. And that's, again, the grocery cart sign. The most common symptoms are pain, of course. Burning pain into the buttocks and sciatica into the legs. Numbness, tingling, cramping, or weakness in the legs. Loss of sensation in the feet. Foot drop, where there's a slap of the foot when walking. Loss of sexual function. Loss of bowel or bladder control. Y'all, it can get serious. Now, the good news is that most of the time symptoms are relieved by simply sitting down. The bad news is that makes it difficult to lead an active lifestyle, and being sedentary, we know, leads to a lot of physical as well as mental health difficulties. More good news about spinal stenosis is that it's not necessarily the size of the holes. Rather, it's what's happening to the stuff inside of the holes. And if we can use techniques to open those areas and to decrease the inflammation of the tissues inside, well, then these symptoms of stenosis can lots of times be relieved very safely and effectively, or at least improved to a point that it's tolerable. Now, sometimes you might need a medical team to deal with stenosis, but in the majority of the cases, in my experience, you just don't. If you're having neurological deficits like bowel or bladder dysfunction, sexual dysfunction, an absent reflex, altered sensitivity, or something as severe as foot drop, well, a medical team should absolutely be consulted. This is not all that common, though, in my experience. Now, typically, It's difficulty, what I usually see typically is difficulty walking that is relieved with sitting, pain when you're walking. And in these cases, there are a few things that we can do in our clinic to help, and help fast. They include non-surgical spinal decompression, where we are trying to increase the size of those holes through traction. A very targeted and cutting-edge exercise protocol that we use. And it comes from Mount Sinai Hospital in Toronto, Canada. And it's been validated through several research projects and has shown significant effectiveness. We share this with our patients and walk them through it and do exercises with them every time they come in. It teaches walking in a way that can help alleviate the normal pressures on the low back that a patient would experience on average day to day. We also use regular adjustments combined with exercises, and we know movement is healing and motion is the lotion for joints. Moving, even when it hurts, is far superior to a sedentary lifestyle for lots of reasons. And then we also use low-level laser. So it's recommended by the American College of Physicians as a first-line therapy for low back pain because it's excellent at reducing inflammation. Again, it's what is happening to the tissue within the holes. And if there's inflammation there and aggravation, the low-level laser can help reduce that, which means less pain, right? So which of those four that I just shared with you, which therapy should you choose for spinal stenosis? And I think that's a great question. According to the American College of Physicians, treating pain should be done through broad management, meaning lots of things working with one goal, and that's pain relief. So ideally, patients would make good use of each and every treatment option available, starting with the least invasive that gives the most bang for the buck. And that means, assuming there are no neurological deficits, a patient would begin attacking spinal stenosis with decompression, exercise, spinal manipulative therapy, and low-level laser. All can be done right here in our clinic at Creekstone. Assuming these safe and effective ways of treating stenosis fail, well, then you would consider medications, pain management options like injections, and or ultimately surgery if absolutely necessary. Again, fortunately, these are very, very rarely necessary, as we can usually get an acceptable level of pain resolution right here in our clinic, all under one roof with Creekstone Integrated Medical. Now, if you're from Amarillo or you're going to be passing through and you want to be evaluated and treated, call us at 806-355-3000. If we can help you get back to your old self and walking all around the grocery store without using the cart, and maybe even have a walk around the block when you get home, wouldn't that be amazing? If you're watching on YouTube or Facebook, share, won't you? This may not be important to you right now, but I promise it's important to some of the folks in your network, and it could be game-changing and help avoid surgeries. Again, I'm Dr. Jeff Williams. Until next time, take care, and we'll see you then.